Welcome to Better Health Together, and you'll see with me here today is Professor Nick Titov, who might be known in many circles as MindSpot and MindSpot GP. But leaving that aside, I've always had a great interest how people can manage their mental health and well-being themselves, developing the routines and habits that are good for our mental health. And you've done extensive amount of work, evidence-based, to develop the big five, as we're calling it, and it's 5 things. I'd really like you to talk about, well, briefly, what are those 5 things and the evidence base about what works and why we should use these 5 things.
We identified all of the kinds of things which have been linked with mental health, and we created a huge list, 500 things.
Wow.
And we managed over time to reduce that list to about 100 key questions.
Yeah.
And what we did was we recruited over a number of trials to start with 6,000 people, 6,000 Australians from the general population, and we asked them how often they did these activities.
Yes.
And also we measured their symptoms of anxiety, depression, satisfaction with life. Now, we used a number of quite powerful statistical techniques, and what we identified was that all of these things are important, but when you really got down to brass tacks, there were 5 key things which floated to the top.
Right.
And they were the things which mattered to most people, regardless of age or gender or background.
Right.
And they were the big 5, starting with meaningful activities.
Right.
So doing things that are stimulating, that are fun, that are engaging. The second of the big 5 is practicing healthy thinking.
Yes.
Keeping perspective.
Yeah.
Keeping those negative thoughts at bay, which always sneak in when we're feeling overwhelmed and a bit anxious.
Yes.
The third is maintaining healthy routines.
Okay.
And this is, I mean, they're all really simple,
Yeah.
but the reality is that they're incredibly complex as well, because things as simple as healthy routines set us up for the day.
Yes, correct.
They establish our
like
routine.
when I get up and cycle early in the morning outside.
And in order to do that, you have to go to bed at a reasonable
That's
hour,
right.
which means that you have to have had a reasonable meal the night before, hydrate that night, that morning, and so on. So routines and healthy routines set us up. That's the third of the big 5.
Yeah, okay.
The fourth, goals and plans. Something to look
Okay.
forward to. That's important
Yes.
because when people are feeling anxious and depressed, their worlds constrict.
Yeah.
They think about themselves, what's happening for them and what's happened in the past. They stop thinking about the future.
Yes.
And having goals and plans, something to look forward to, extends us. It
And
challenges
that
our
could be
thinking.
a goal and a plan for today as much as next week or next month or next year.
You know, and working with people with quite severe symptoms of anxiety and depression, we often say, how about your first goal is get out of bed, brush your teeth before 9 o'clock in the morning.
Yeah.
Maybe simple for most people, but for when people are struggling, that may actually be the most important thing they can do. And then you build on that, as you say, to having those extra goals and plans. And the last one is social connections.
Yes. Yeah.
What's interesting about social connections is that there's no one size fits all. Some people like lots of engagement.
Yep.
Others just have 2 or 3 people. They just want to SMS 2 or 3 times a week. Now, those are the big 5. So meaningful activities, healthy thinking, goals and plans, healthy routines,
Yes.
social
And
connections.
social connections.
All of those things are really self-evident, right?
Yes.
Here's where the magic is. And this is one of the things we've found again and again. So I mentioned we started off with trials with 6,000 people.
Yes.
We've now replicated those results with an extra 20,000 people.
Whoa, okay.
And this is important because good science is based on replication.
Yes.
You identify something, you extend the results, you replicate, you test across different populations, and you're always trying to prove yourself wrong.
Yeah.
But one of the things about the big 5 is they keep rising to the top. But the magic piece here is the frequency.
Right.
So I mentioned earlier, drink 2 glasses of water or brush your teeth twice a day, whatever it might be. What's magical about that information is that there's an action and there's a frequency.
Yes.
And with all of the big 5, we know the things we can do which help, but the frequency is about half the times of the week at least, half the days of the week.
Yeah. Yeah.
And we created a very simple checklist, which is available from our website. In fact, Health Director picked it up as well, which has a very simple traffic light coding system, and you can score yourself, and it shows you, are you doing enough? Are you doing a moderate amount? Are you doing not enough?
Yeah.
And should you do more? And by just looking at that very simply, people get a really very clear sense of, well, I actually need to do a little bit more of this.
Yes.
And as soon as they start doing it, and it's not a big leap,
No.
they feel better.
But the important thing is, so it's evidence-based from all the trials you've done, and it's a really simple tool that support workers or GPs or whoever can refer people to say, here's how you can take care of your mental health. My view is you stick it on the fridge.
Yep.
It's like taking the milk out. Here's the 5.
Yep.
And you then build the routine.
Exactly.
And look, I think the wonderful thing about this is it is simple and straightforward, incredibly well tested and evidence-based. And therefore, you know, people will have confidence in saying, here, try this, you know, or go to the MindSpot website and find it. But thank you so much, because I think the key to improving mental health and wellbeing going forward is for people to have these tools that they can hold, see and use without too much, you know, support and drama. They can just do it. So thank you so much for your time, but more importantly, thank you for your work in driving this. I really appreciate it, and I'm sure millions will going forward.
Thanks, Leanne.
So thank you.
My pleasure.
Bye for now.